Hyperglycemia. The school nurse, when available, is the most appropriate person in the school setting to provide care for a student with diabetes. However, many schools do not have full-time nurses. Even for schools that do, the nurse may not always be available at all times during the school day, during school-sponsored extracurricular activities, or field trips to assist with routine care and emergency care. Trained school personnel must be available to perform and assist the students with diabetes care tasks. This presentation is not intended to provide legal or healthcare advice. Please consult with a legal or healthcare professional regarding your specific questions or needs. Each training component was created specifically for school nurses and other qualified healthcare professionals to train school personnel. This unit is hyperglycemia. The objectives are for participants to be able to understand and recognize high blood glucose symptoms, treatment of high blood glucose, reduce risk of high blood glucose, and short and long-term risk and complications. Let's review a few vocabulary terms related to hyperglycemia. Hyperglycemia is a high level of glucose in the blood. Ketones, or ketone bodies, are chemicals that the body makes when there is not enough insulin in the blood and the body must break down fat for its energy. Diabetic ketoacidosis, or DKA, is an acute metabolic complication of diabetes characterized by excess acid in the blood, which can be life-threatening. Ketone testing, a procedure for measuring the level of ketones in the urine or blood. Glucose, result of food being broken down for energy. All body cells need this energy to function. Hyperglycemia is a term that refers to high blood glucose level in the blood. Yet the irony is that with all the glucose floating around in the blood, the body's cells are actually starving because glucose cannot get in. An isolated high blood glucose reading is cause for concern, but not alarm. For example, blood glucose is expected to be somewhat higher following a meal or snack, but it should also drop once insulin starts to work. However, it is also important to note that hyperglycemia can occur more rapidly in students with insulin pumps if a pump malfunctions or delivers less insulin. Illness or infection can also contribute to a more rapid escalation of hyperglycemia. Hyperglycemia becomes an increasing concern when several consecutive readings have been high or when accompanied by vomiting. As hyperglycemia progresses, the student may be nauseous or be dehydrated and listless. Often symptoms may appear to be flu-like. Any student with diabetes who present with flu-like symptoms should immediately perform a blood glucose check, contact the school nurse and or parent guardian as directed by the student's DMMP. Hyperglycemia most often does not appear to be as dramatic as does low blood glucose, so it is perceived as less threatening. Yet, untreated, high blood glucose presents a much greater threat, especially for students who are dependent on insulin. If there is not enough insulin for any reason, or the pump malfunctions, failure to take insulin, or insulin not working effectively, there may be a breakdown in fat, causing ketones to form. Ketones may build up in the blood and may result in diabetic ketoacidosis, or DKA. Fortunately, the onset of hyperglycemia and progression to DKA is usually pretty slow. The student's DMMP should determine precisely what actions should be taken at each level of severity of hyperglycemia. The onset of severe hyperglycemia and progression to DKA is usually pretty slow. As a result, the recognition and treatment of mild hyperglycemia is vitally important. These symptoms vary somewhat from individual to individual or from episode to episode and can include thirst, blurred vision, lack of concentration, weight loss, frequent urination, sweet, fruity breath, fatigue or sleepiness, stomach pains, increased hunger, and flushing of skin. The following symptoms indicate that hyperglycemia has escalated: dry mouth, stomach cramps, nausea, sweet, fruity breath, and vomiting. This last group of symptoms indicate severe hyperglycemia and probable ketoacidosis. These symptoms include labored breathing, confusion, profound weakness, and unconsciousness. The important thing to remember is that intervention at any of these levels will help to prevent progression to more severe symptoms. There are several important reasons to learn the signs, treatment, and prevention strategies for hyperglycemia. If left untreated for an extended period, hyperglycemia resulting from insufficient insulin can lead to diabetic ketoacidosis, or DKA, and/or coma and death. The onset is more rapid for students who wear insulin pumps. High blood glucose can affect a student's general well-being. Students who do not feel well are less able to learn and participate in school activities. When glucose levels remain high over time or are reoccurring, serious life-limiting complications of diabetes develop. Diabetes is the leading cause of adult blindness, lower limb amputations, kidney failure, heart disease, and stroke. Many students with diabetes will not experience symptoms from high glucose level until the level is far above target range. Therefore, glucose testing is needed to identify otherwise undetectable high glucose levels. The good news is that treating high glucose levels in accordance with the student's DMMP enables students to participate fully in their education and enhances their health and well-being in the future. To prevent progression, action needs to be taken at the first sign of hyperglycemia in accordance with the student's DMMP. The goal in the treatment of hyperglycemia is to lower the blood glucose level to within a student's target range. Always follow the individual student's DMMP. Generally, the action steps for hyperglycemia are as follows. Verify status with the blood glucose check as specified in the DMMP. Check ketones as specified in the DMMP. Allow free use of bathroom and access to water. Administer insulin as specified in the DMMP. Recheck blood glucose per DMMP. Notify the parent guardian immediately when the conditions for contact are present as specified in the DMMP. Note patterns and needs for bathroom or water access and communicate with student, school nurse, or parent guardian as specified in the DMMP. Hyperglycemia possible causes. The first 4 items on this list, late or missed or too little insulin, expired or improperly stored insulin, food, physical activity are the main players. Keeping these in balance is generally what keeps blood glucose from going too high or too low. Let's talk about these factors in a little more detail. Forgetting to cover a meal or snack with rapid-acting insulin can happen. The concern is when students have not taken their long-acting or basal insulin. Students on pumps are especially vulnerable to high blood glucose if their infusion site dislodges or occludes, preventing basal insulin delivery. Too much food or food that is not covered by insulin may be inadvertent, not realizing how carbohydrate-rich a particular food is. For example, a student who is used to eating grocery store bagels at home may not realize that some shop bagels are 2 times as rich in carbohydrates. Other factors may also play a role, such as expired or spoiled insulin. Insulin that is beyond expiration or has been stored improperly can lose its potency and can cause hyperglycemia. An unexplained high glucose may be caused by illness, injury, or infection. Stress, hormone fluctuations, including menstrual periods, may also play a factor in hyperglycemia. Other hormones, such as glucagon, growth hormone, adrenaline, cortisol, or medications, also play a factor in hyperglycemia. Because severe hyperglycemia is generally slow to develop, school personnel can do a lot to prevent or minimize hyperglycemia by doing the following. Timing is very important in all aspects of diabetes management. Eat on time, check blood sugars, glucose on time, take insulin on time, and perform physical activities on time. Ensure that insulin dosing is accurate according to the guidelines in the DMMP. The DMMP should specify what assistance, if any, is needed. Take appropriate action according to the DMMP if a missed dose of insulin is suspected or if an insulin pump malfunctions. The same kind of accuracy in dosing needs to happen with food as well. Many students will be able to choose foods independently if provided with carbohydrate information. However, some students may need assistance or monitoring as indicated in the DMMP. Extra snacks can be a problem if not worked into the overall meal plan for the day. On the other hand, many special snacks can be accommodated in consultation with the parent guardian. Be sure each teacher knows to consult with parent guardian prior to serving extra snacks. Changes in snacks, meals, or physical activity times should only be made after consultation with parent guardian and the school nurse. Here are a few practical implications for educators related to the prevention and/or intervention of hyper and hypoglycemia. Students with hyperglycemia or hypoglycemia often do not concentrate very well. Students may need to have information repeated. Students should have adequate time for taking medication, checking blood glucose, and eating. During academic testing, students should check their blood sugar before and during, if indicated, on their plan. Students should have access to food and drink and restroom during the testing period. Students should be excused from testing with an opportunity for retake later should a serious high or low blood glucose episode occur. Making the right choice is the easy choice when eliminating barriers to diabetes management. Become familiar with and follow the 504 plan, the DMMP, the IHP, and/or emergency care plans. Eliminate barriers such as barriers to snacking, barriers to blood glucose checks, barriers to access to water and bathrooms, and eliminate barriers to insulin administration. Avoid judgments based on individual blood glucose readings and communicate with parent, guardian, and school nurse.